Coronavirus itself is just a family of viruses. They've been around for many, many years, and typically they cause the common cold. The COVID-19, coronavirus 19, is a novel coronavirus. This means that we haven't seen this one before. Additionally, this coronavirus seems to spread person to person very rapidly and cause a lot of illness in people. Generally, most people do okay with it. However, people with underlying medical conditions have very severe illness from it. It's spread by getting in through your eyes, your nose, or your mouth. So the most important thing, of course, is hand washing, hand washing, hand washing. We need to make sure that we are not getting the virus when it's on our hands into our eyes, our nose, or our mouth. And so making sure that whenever we touch anything, we hand wash or use an alcohol-based hand sanitizer is the most important thing that we can do. But it's not just that. There's also other things that we should do. So we should stay away from people when they are sick. If people are ill and they're sneezing by you, they could sneeze on you, and of course that could transmit the disease. So you want to stay away from people who are sick. If you're sick, you want to wear a mask and avoid going out so that you're not transmitting it to other people. So the CDC does not recommend that normal lay people wear a face mask to prevent getting coronavirus. Face masks are important if you are sick in order to prevent you from spreading it to other people. So if you're sick and you have a face mask available, then it is recommended that you wear that so that you're not coughing and spreading the virus to others. Face masks are recommended for healthcare workers, of course, because of the close contact we would be having with patients who have known coronavirus. Most symptoms of the coronavirus are mild. These are normal upper respiratory symptoms: cough, runny nose, fever. If you have those and are not short of breath or having trouble breathing, you should stay home. Now, of course, if you are short of breath or feel that you need immediate medical attention, you should go to the emergency department. However, when you arrive at the emergency department, please make sure when you come in, you put a mask on. They're available at the triage desks of all hospitals. Wear a mask to protect everybody else, and let them know right away that you're concerned you may have coronavirus and why. Riverside has been very proactive in the coronavirus outbreak. Our main steps are, number one, when a patient comes in, we want to identify them as a potential coronavirus patient. And so immediately when somebody comes in, if they are having any signs or symptoms of an upper respiratory infection, they are asked to put on a mask. That's the first step. We then talk and decide if they could be at risk for coronavirus. If there's any risk, we isolate the patient immediately. We want to take these patients away from the general public so we're not transmitting any infection to them, and so we will put them into a private room right away. After the patient is isolated, we will then do a further workup with the patient. If we are concerned that they have a potential for coronavirus, we will then notify the public health officials in order to facilitate testing of the patient. The biggest thing is not to panic. Panic is not going to help anything. I expect that we will be seeing a large increase in the number of coronavirus, and I don't think that will be a cause of panic, because the reason we will be seeing an increase will be because of increased testing. So I think we will start to see cases in the near future that we just hadn't been testing before. The good part of that is it will show us that the overall mortality rate is probably much less than we think it is, because we're testing so few at this point. So I would say as we go on over the next days to weeks and we're seeing more cases, that's not a cause for panic. That's expected at this point with the increase in testing. There are companies working on coronavirus vaccine, and actually they will be starting animal trials in April of this year. However, it is a long process to go through in order to get a vaccine to market, and that's because we need to make sure that they're safe and effective for people.